Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and today I want to talk about an interesting subject, something called lichen planus, or oral lichen planus. Lichen planus is basically an autoimmune disease. We don't really know what causes it, and there isn't really a predictable cure for it, although there are treatments for it. If you have a burning mouth and it's quite uncomfortable and you don't know why and your dentist can't figure out why, it's very possible that you do have lichen planus. In order to confirm that, typically we take a small sliver of tissue and send it in for examination. That's called a biopsy, and the biopsy can give us a very definitive diagnosis of lichen planus. And there are a number of approaches to treating it, not curing it, but controlling it, at least making it more comfortable for you. Lichen planus can affect other parts of the body too, but we're going to talk mainly about oral lichen planus. You know, it's interesting, I've been having a lot of patients lately who have lichen planus. They don't know that they have it, but they come in and their mouth is like just burning or sore, and they can't figure out what it is. And upon close examination, we can see little white patches in their mouth or little white spots, or sometimes we can see a lace-like pattern on the inside of the cheek, and these are the typical signs of lichen planus. Now, lichen planus can become much more severe. It's then called erosive lichen planus. And actually, when it becomes erosive lichen planus, there's a slight but increased likelihood that it could evolve into oral cancer. Anywhere from 1 to 5% of erosive lichen planus may become oral cancer. And so if one is diagnosed with lichen planus, particularly the erosive or the more severe kind of lichen planus, one should get monitored periodically. First of all, if it's not too painful or bothering you too much, if it just feels a bit rough, there's nothing necessary, you don't need to do anything. But if it's starting to get uncomfortable, the first line of treatment is topical corticosteroids put on the gum tissue to reduce the inflammation and the discomfort. Sometimes if it's more advanced than that or it's not responding, oral corticosteroids in pill form may be taken. We're also now using a laser in some cases, so there are a number of other treatments that are being developed that can help improve the prognosis of lichen planus and make it more comfortable. Now, one other thing that I've noticed, because I've been seeing a lot of these cases, and I don't know if it's coincidence or not, but my own feeling is environmental exposure can be a contributing factor to these cases of lichen planus. Most of these patients, many of them, have been exposed to strong fumes, chemical fumes, paint fumes, sometimes pesticides. In fact, I just had a patient just a half hour ago who was testing airbags and was exposed to strong vapors from the airbags, and he absolutely had lichen planus. So I think there's a lot of environmental factors. People who have asthma who've been using inhalers for a long period of time. I've seen a number of these people who are developing a burning mouth and lichen planus. But it may not show up for years, maybe not 10, 15, 20, even 30 years later, until it manifests itself in the form of burning mouth and lichen planus. So here are a couple of examples of patients with lichen planus. And if you look, you can see a white patch here, a white patch here, kind of white patches here. And this tissue is red, it's sore, it's very uncomfortable. And so something needs to be done to help this patient reduce the discomfort and the pain associated with that. Now, this is a much more severe case of lichen planus. Typical lace-like pattern, very, very obvious. Typically, it's not usually as obvious as this. And this will come and go. It'll get better, it'll get worse. We have periods of remission and exacerbation. This actually was more uncomfortable than that was. And this is burning. It's very uncomfortable. It's red. We do what we can to palliate this or reduce the discomfort that the patient is having. I mentioned I saw a case just about a half an hour ago. Patient just left actually. And this is that case. The patient was having chronic discomfort in the lower right side. Didn't know why, couldn't figure it out. This is a much milder case of lichen planus than the other two that we showed you, but still significant enough to make him uncomfortable. And let's look closely. You can see white patch along here, white patch along here, all along here, and it's actually just starting in the cheek, but you can barely see that. That's very, very, very faint. So we're going to do something. We'll probably take a biopsy, that is a sliver of tissue, just to confirm the fact that it is lichen planus, but there's no doubt about it in my mind. But not all lichen planus cases are as obvious as the first two we showed you. So if you're having symptoms of a dry, rough, burning, uncomfortable mouth, get it checked out, go to your dentist, go to a periodontist, see what's going on. Remember, keep your mouth healthy. If you have a healthier mouth, you're definitely going to have a healthier body. Have a great day.
Restore your smile and your health with the help of Dr. Nemeth and his associates. Visit drnemeth.com to schedule your appointment today.